Okay, it is my pleasure to introduce Martin Grable of One Blood and John Mass of the American Red Cross. They are here to present on Circulate LLC, Collaborative Blood Intelligence. As I mentioned earlier, this is a private sector effort at developing real-time data around the amount of blood that is collected, about 60% of the blood supply. So I turn it over to Martin and John.
Make sure everybody can hear us. Assuming that is the case.
I can hear you. Thanks. Yep.
As Claudia mentioned, I'm Martin Grable. My day job is Chief Financial Officer at One Blood. And joining me is John Mass from the American Red Cross. He's the Vice President of Biomedical Business Systems. And we're here today as two of the member managers of Circulate. So give you a little bit of background. We want to thank the advisory committee for the opportunity to present here today. This is one of our early presentations. So we have a slide deck to run through. But going back a little bit of history, it was January 2020 that Circulate first formally met to discuss how to move this project forward. Our discussions then, as they remain today, were focused on how do we help contribute to a solution to the data issues that were surfacing in the ACBTSA work groups that we were all participating in at the time. Then, of course, we had a pandemic, but the work of the advisory committee and the work of the Circulate group continued on. So Circulate today, and change slides there, John. So the concept of a national data warehouse for blood's been around for many years. And for as many years, there have been as many ideas, concepts, and visions about how it worked. So we wanted to provide a little bit of foundation specific to Circulate. And the foundation and governance is important, albeit maybe not as interesting as the data and analytics that John will get into here shortly. So I'll try to be brief. But as you can see, Circulate is a collaborative partnership between the American Red Cross, Gulf Coast Regional Blood Center, One Blood, and Vitalant. Not intended to be the end of the group, but this was a small collaborative group that at the same time represented scale. Small enabled rapid development. Scale is important to proof of concept, and both were important to proving the possible. So the purpose is really to provide data-driven insights to promote the blood supply. More to the point, it was not designed to be an industry benchmarking platform. So established in December, formally as first really effort at formal establishment was December 8th of 2022. And regards organization and formation, I'd want to be clear that Circulate LLC has always been envisioned by this group to be an organization operated exclusively to further scientific and educational purposes in the by definition of 501c3. And to that point, it is designed to operate as a nonprofit. It's governed by a board of managers, and governance was by definition established to provide for the extension and expansion of Circulate over time. Again, never designed to be a data repository for a few, but for all that choose to participate over time. Most specifically, it was designed to be a solution and platform to address the issues raised in the 2020 report to Congress. So moving to the next slide. The report to Congress clearly called out the key issues regarding disparate data collection, specifically the need for a national view, noting there was no single source of real-time data to track the blood supply, monitoring changes in adequacy of the blood supply, today remains a manual, decentralized, and imprecise process, and the absence of real-time data on supply and utilization make data-driven decision-making difficult. So recommendation, next slide, of the report, recommendation 4.1, clearly articulated the objective Circulate seeks to be responsive to: comprehensive, sustainable, minimally burdensome system that monitors and makes available near real-time data to assess the supply and utilization of the nation's blood supply to more accurately assess adequacy. Next slide. So Circulate collects unit, and I'm going to define this carefully, but unit and product level data daily, providing the ability to report out units collected, products made, quantities on hand, and days on hand. Those two are different. Units shipped, and uniquely the ability to break that down by ABO and ISBT coding, so down to a product level, and other defined specificity associated with unit level data. So automating then the data collection, we are auto-loading data daily. The automation minimizes the drag and time to collect and compile data while improving messaging grounded in that data. It is a key word here is methodical. It is automated. It reduces the drag, and then providing the data, informing the purposes to inform and support the regulatory and legislative initiatives, public policy decisions with the data behind it. This has been a repeated concern over time, historically. Leveraging the data definitions, defining and standardizing definitions are key to consistency in blood component collection, manufacturing, distribution, and the reporting of it. So daily, when we talk about monitoring stability and availability, daily product level data collected consistently and quantified as days on hand or in total quantity using standardized data definitions are the objective. This provides insights into periods of transition, standards of care, utilization or adoption rates. Think about how we introduce new products. There've been a lot lately as a result of bacterial risk guidance, but we also have evolving transfusion standards around whole blood versus individual components. And so the ability to look at how that progression is of transfusible products is important to be able to quantify. And these are the questions and issues Circulate's trying to address and support. So if you move on, the benefits to this are effectively consistent, harmonized data, definitions, calculation, consistent, methodical, and repeatable data, fundamental to data analytics. The ability to recursively load data sets to correct or enhance the functional foundation of the data. That's to say, how many times have we asked a question only to realize we need just another data element or another piece of data or a bit more information to get to the core of the issue? It happens almost every time. Longitudinal discrete data sets can be extended and requeried. The ability to go back in time and load an earlier period so that we have more data available to put within the framework of answering questions. And then extensibility, fundamental to expanding the data sets to support future data initiatives. The ability to relate our data and circulate to external data sets. Think of geography or demographics, dates and events. But we saw the early proof of concept in this back during COVID, which we were working through with the Johns Hopkins COVID-19 tracking of inpatient hospitalizations associated with COVID virus. Hospital partnerships would be another. The ability to, besides just the units that we are putting into supply or putting into the supply, but the hospital's utilization of those units could be integrated in this fashion. So Circulate's data also has the ability to distinguish between component types, and actually I'd say ISBT coding is a standard that we're using. ABO and other distinct attributes of a product define its distinct granularity. And just as age, sex, ethnicity more distinctly define a donor, so do these characteristics about units that make the data richer. Finally, the data and the exhibits are refreshed daily, easily manipulated by the end user. And that's to say that we have a rich reporting dashboard and dashboard level access to the data. So my final comments along this line is Circulate's been built with an open architecture concept to ensure the ability to add additional participants independent of an operator's BECS. This data is coming ostensibly from the BECS, but all 4 of our blood centers currently contributing data use different BECS systems, and some are pulling from more than one. So finally, we put a lot of time into the data structures, but we also put a lot of time into the foundation and governance of Circulate, believing that by doing so, we would be able to deliver the assurance that would have others want to be a part of the participation and comfortable with it. Data in our work is reported out and available on a national, or we have the ability to use predefined regional levels, but never as a single blood center. So that kind of gives the overview of the process and the timeline and the foundation that we have laid regarding Circulate as a data solution. John.
Yeah. All right, Martin. Just a quick check. Make sure you can hear me okay. We're good?
Yep.
Okay. All right. So John Mass, right, Vice President Biomedical Systems, right, at the Red Cross. Obviously one of the team members, when we think about Circulate and the vision for Circulate really started, Martin mentioned, started several years ago. It took a lot of work to kind of harmonize data sets, automate data sets and those items. And we'll be talking through basically some of the capabilities. One of the things, obviously, there's data and then there's insights. And in some ways, we really had to solve both problems. And really, how do you get to the right level of data? The goal here is to talk through. This is just I would say, tip of the iceberg, but that could be a good metaphor. As far as the richness of the environment, and so we'll talk through how and what we built, right? So from that point of view. So at its core, right, if we really think about understanding, we wanted to be able to estimate the national supply, but not just the national supply, but by various product groups, right? We talk about red cells, but obviously, we get into the ISBT standards, there's 10,000 codes that represent all the various different products and different product states. So one of the things we did was really go to first principles. The lowest level of data we wanted discrete, the equivalent of serial number level data down at the individual, right? So essentially not use aggregated data, which as Martin mentioned, allows us to requery, refigure, right? And it gives us also some standards by which we can use those, longitudinal analysis. The other side of it was really we had to work up as a team, work up definitions for what is a unit of good stocked inventory, what is the definition of ship, what is the definition of discarded. So one of the things was as a group working through those kind of definitions, so we had the level of data we wanted to go to. We also had to get to the definitions and then basically get the data flows running. All of those data flows, as Martin mentioned, are automated. So every single day, discrete DIN level, ISBT level coded data is going into the system from the 4 blood centers. That's all automated and then monitored. And then that also allows us then to build on top of that by different component groups and whatnot. We also had to do a couple of things. Right? We got into estimating days on hand, which is a great estimator in understanding how, exactly how much product is there, how many days can we go. Well, one of the things we mentioned, not only do we have multiple BECs, but we ran into about 10 different ways days on hand could be calculated and were being calculated. In some cases, within some organizations, they had multiple definitions of that. So really, it was also standardizing a definition for that item that we could apply to the data sets in a repeatable fashion. And then also using the model, right? We represent about 60% of the supply or the product. Could we estimate, could we build an estimator that would also sort of help us understand, well, days on hand is a non-dimensional unit, right? But could we estimate the total number of units of any given product and product class? So also build those kind of items. So with that, we're going to go through a couple of samples, obviously answer questions, again, tip of the iceberg type stuff. But one of the things we really did was, okay, now when you take all of that, we were able to then automate that, define that, and then build basically an integrated, Power BI or a reporting platform or a business intelligence platform that does allow us to monitor things and monitor how things change, which has really proven to be one of the key insights. So obviously by product group, by blood type, right, we can, at its macro level, how many days of O pos, O negs do we have on hand? Not a surprise, when we see stuff where APOS, just because of the collectors and sort of basically product usage, right? You generally have more APOS days on hand than you do have with the O and O negs. Likewise, platelets, I think that's a great, an obvious question, right? How can you have less than 1 day on hand with platelets? But when you look at short shelf life products that turn very, very quickly, and you factor in discards and other items, you actually, you start to see basically very, very, platelets aren't really measured days on hand. They're really measured hours on hand if we really think about how the industry works. And that's obviously with any kind of product that expires. So top part, days on hand, it allowed us to kind of harmonize on that, build it not only, a firm definition that we could use in a repeatable format, but then also I'll build an estimator, sort of exactly how many units do we think are in inventory in the country at any given time. Obviously, any kind of estimator has an error rate, but we're using the 60% to basically, we feel with that, obviously 60% of that number has a very low error rate. It's the extrapolator, the other 40% that could contain a small error rate. So with that, we're going to step in and talk through, a couple items, right? We'll go through, and just to kind of give everybody an idea how this works, we'll talk through, the importance that we found from having that daily, having that close in near real-time data was incredibly important, let alone the definitions for, things like days on hand. So this is an example of basically our ability to look at days on hand once we got the definition of days on hand and this is all product or all blood types. So we were able to then look at time-based series, and one of the things that's Circulate has been putting in data, especially around inventory, for 2 years now, or 2+ years. So we have daily data at the unit level for those, that period of time for inventory, and allows us to basically obviously query it. But one of the things you see, any kind of model, the days on hand really represent which day of the week we're talking about as well, because obviously different, the use of blood products varies significantly day over day as you go through the weekends. The goal of this chart is really, the daily data matters, right? Obviously, from that point of view, the days of the week and sort of what happens on any given day. Obviously, once you have that kind of data, you can do the averages. But really, the goal is to show, basically that we're at that level. We're at the daily level. Then one of the things as we go through, get to the advanced slide, allows us then to look at, how do things change year over year? How do things change from both the quantity of units, and the time series happens, and also looking at the days on hand, how do they correlate? One of the things you see is the days on hand strongly have a very, very strong correlation with inventory. In other words, and the only way that happens is if the underlying premise is the consumption is relatively level. So one of the things we see, when we start to look at the units on hand, and just a couple of insights you get out of this is, while we may have 3, 4, 5 days on hand, the rate at which that can change is significant. And essentially the supply, and when you look at some of these, the day over day rate of change for some of these areas, you see that the supply can degrade very, very quickly. In other words, our ability as a country, right, our ability, because of the way, not only the collection, but the consumption model, is that within a few days, you can very quickly go from plenty of supply to go into a red and very quickly need to basically go on appeal. And if we look at the left side of this graph, one of the things you see is that the inventory, the rate of change of the inventory was decreasing very, very quickly. So between, literally in 5 days, from green to yellow to red, and without that daily data, it's very hard to see that rate of change. It's very hard to see, sort of to reconcile why are the various blood centers going on appeal, whereas literally, a week ago, everybody was in good shape. So that's one of the insights we got, but it was basically by looking at that, it's not so much the inventory, it's the rate of change of the inventory. And looking at the cyclical nature of that. So we'll keep going. A couple more examples. One of the things, so how does inventory on hand change, right, year over year, when we look at just that whole being able to compare the days on hand and the units on hand, right? One of the things we're able to do, kind of going back to first principles, because we have the type, because we have the ISBT codes, because we have the individual units, we're able to go back, requery, and say, well, wait a minute, what's happening with the O's? And to what extent do the O's represent, are they, everybody knows about O negs, right, in the universal usage of them. One of the things we saw was really O-pos could be and maybe almost a better indicator of health and resiliency of the supply. One of the things that just kind of comparing the two graphs, and when we look at over time, right? So the O's and O-pos grow significantly, but the distribution, and as you get out to the right, in some ways, the fact that they didn't grow, in the latter part of the year does represent that the stress, right? It's basically its ability to sort of identify where there is additional stress on the overall system. So a couple of, the ability to drill in, right? Just kind of being a little bit repetitive, daily data, right? Having that daily data allows us to get the insights into what's happening with the supply, how the supply is going up and down. Very, very important for us to understand, that we've started to really change our view. It's about the rate of change is really what represents whether we're in a good state or, a positive state or negative state, because things can, just due to the nature of the turnover of all the inventories, degrade very quickly. Obviously, then the ability to drill in, right? And not only do that, but then to look at how does it change with an individual product line, right? So we're going to let's go forward here a couple more. So then again, we can look at it, quantity on hand by type, right? So this is another good example over the year. How do the various quantity on hands change? And where are the run-ups in inventory and those items, whereas where are the inventory items that that are, are basically perpetually stressed. And then not only be able to do that, as we kind of walk through these items, the ability to see how are the days on hand changing, to understand, that aspect as well. So I'll move us along a little bit. We got a couple more slides that get us into platelets, right? So just kind of being repetitive. Rich data set. As soon as we have the inventory units, we can then look at by product group. We can understand how those product groups change and really be able to kind of understand, you draw some conclusions from them. One of the challenges we obviously see with platelets, very different shelf life for the product. And when you see that, you also see that the inventories really do not change that much. And you also see that in general, a very stable, essentially a flat, right? It's a very flat curve in that, we basically run the process, we run the system with platelets on approximately 1 day, right? That in general, there's about 6,000 units available on any given morning, and the bulk of those units move that day, right? And they either move in two directions. Obviously, they move towards discard, which really shows us the bottom side of this chart, shows us how, basically that discard rate and those items, but then also how many are making it all the way to the hospitals and being put to good use. Another slide on platelets is year over year. One of the questions we see and, that we strive to ask over time was, what's the platelet demand? How is demand changing for these various products? And one of the things is the ability to be able to do a year over year analysis and understanding that, taking that data, we can see that the demand for platelets is going up. It gives us an independent data point from all the blood center members to understand, so essentially what is happening in demand and ensure that the blood centers are pivoting towards that to meet the demand. We're going to go to a couple more. We'll talk. So one of the things, as soon as you do it by inventory type, as soon as you do it by ISBT, as soon as you do it by DIN, basically those, you're at that lowest level of serial number. Allowed us also then to obviously plasma, cryo, pretty much any of the ISBT, anything that has an ISBT code, we can create the families on, we can create the groups, and then basically run that reporting through. And that data, because we went with the ISBT, we were at that lowest level data, allows us to basically requery those groups. So if tomorrow we need to go look at, say, leukoreduced red cells and what's happening there, or we need to look at, basically because of a certain additive, it gives us the ability to do that. All right, let's get into, some of the challenges. So AB plasma, another good example, year over year, what's happened, right? How many units of inventory are there that we're estimating? How has that changed? One of the things you can see, there were some challenges with AB plasma over the last year, right? Where the inventory was getting pulled down, right? There were some issues with supply chain. This is a good example where we're part of the supply chain, obviously as providers, but there's also all the materials we use to get there. And at different times over the last year, we have had supply chain issues in our industry. And obviously the ability to understand those, understand what's happening with inventory. And also then regulatory changes. When there's certain regulatory changes, they also impact the products as well. So the ability to track and trace, the ability to see how that data is working at the daily level gives us those allows us to draw the insights. And then likewise cryo, so another product family that's very important, for obviously for the recipients, but the ability to understand units shipped, understand how many we're adding, right? What kind of discards there are for those items as well. So with those rich data sets, it does allow us to basically requery those items and, really draw the right kind of conclusions. So it's, if we think about it, there's millions, right? I think we've got we send in about 10 million a year. So there's probably about 25 million records that basically allows us to requery. The macro view is automated data feeds go in, right, that are standardized. Everybody agrees on the definitions. Everybody agrees on the formats of those items. Those get turned into the information models. Obviously, then we build a reporting, a business intelligence platform on top of that allows us then to understand those items. And as I was mentioned, I would like to kind of just in closing go back. One of the big items, well, this is a good example. It's the rate of change. When we talk about the ability to respond to a mass casualty event, it's really about the rate of change. There's the in-stock inventory, which is one part of it. But if we really kind of go back, and I'll go all the way back to the red cell graph, which I think is very illustrative of our ability as an industry to move on change. It's, when we're into a drawdown situation, obviously those happen very quickly. And when we look at the year-over-year date, it was somewhat surprising that it happened on exactly the same date. The low date for inventory and the correlation for those, granted, we only have 2 years of full detailed data, but happened on or about the same date. And not a surprise that January is a very, very stressful period for the blood centers, hence why so many are going on appeal at the moment. In some ways, it's predictable because of what happens right around those holidays, the big changes on holidays and how, basically product is consumed or needed, I guess is a good way to look at it within the hospital settings, and then what's happening on the collector side. The other side, when we talk about mass casualty, it's really understand we have a pretty good idea how the industry can react, right, in the very near term, because that's exactly what the industry is doing every year. The unknown, and where I think there's a very, very real opportunity, is one step behind that is the bags. It's all the supplies and the supply chain that's needed. And obviously the blood operators cannot move quicker than really the labor, right? There's the donors, right? And when we do a call, if there is a need, the donors show up, right? That's one of the, like Blood Donor Month, right? One of the beautiful things about sort of this industry is when the call goes out, the donors show up, right? They volunteer, and as needed, and quite often we can augment staff that way as well. But there is a staff capacity part of it. But one of the challenges, and it has proven to be somewhat at the weak link over the last year and a half, has more to do with the bags, right? And it's our ability to understand and monitor that, which is really probably does tell us what our real close-in capacity is. Because in some ways, you as soon as you exhaust that bag manufacturing, that's where the stress really, really gets applied. And so one of the things, just thinking about mass casualty events, thinking about if we really, really needed to increase, right, our consumption. Obviously, there's what's in stock, but depending on what time of year, it's understanding bag supply is an area from a circulate point of view and a supply chain point of view we're very interested in. Obviously, the other side, we're always interested in donors, and our ability, the profile of the donor base as well, but it's also looking at, both sides of the equation and looking deeper into data. So Martin, that was the run through. I think we're pretty good on time, right? I think we have time for questions, Claudia, right?
Well, thank you, Martin and John, for this presentation. That was very interesting. We have time for 1 minute for just one question. Anyone? Please raise your hand. Sridhar.
Hey guys, thanks for this talk. I know we don't have a lot of time, but I guess the question I had was, do you see that the system could at some point become all-encompassing enough of all of the US blood collectors? There's over 100 of them if you include hospitals. And that it could one day maybe replace the NBCUS in terms of its representativeness, quality of data.
I'm not sure it should. I don't think replacing NBCUS is really the mission, is the right mission for Circulate, right? I think complementing that is a better mission, right? And to your point, it's very, very difficult to, we do have standards and we can grow. Right, that's a good thing, right? It takes an effort to bring in the blood. It's disproportionately, for lack of a better term, from an effort for the smaller collectors to get involved, right? just because turning on that kind of infrastructure, and a lot of them don't have the same, to be very blunt, resources to basically automate them. So I think from our point of view, this is complementary NBCUS. NBCUS collects some other data. NBCUS also is very, very powerful because it also pulls in a lot of hospital information as well, which isn't really part of the mission for Circulate at the moment. So I think it could help, right? I think it could really streamline possibly some of the data feeds, that go into that information. I think it could probably put, from that point of view, but I wouldn't see it as a replacement for that. I would see it as something complementary and something that's streamlined and basically provide, faster, right? Faster, better, cheaper data, right? One of those items.
We're over time. However, Cassandra Josephson has a quick question. If people need to begin their 25-minute lunch break, please do. But John and Martin, if you don't mind staying on, anyone also may stay on if they wish to hear this question and discussion.
Thank you. I'm sorry that I couldn't get my mute off fast enough, so I got beaten to the punch. I wanted to ask a question about first of all, what you presented was amazing. So I think it's great. How do you manage when you have transfusion services that are in hospitals and you are looking at what or have you factored in what hospitals inventory are holding on to? When you're factoring in what you have on hand each day. I just wondered, because a lot of the places you presented have transfusion services, and I didn't know whether you were factoring in what they're holding on to in the hospital at all in this calculation.
No, we weren't, right? There's two parts, and this kind of goes with Sridhar, right? There's the providers, what the providers are doing. Some of those hospitals are obviously, they're sitting on inventory as well. It's probably a pretty good indicator. There's not many more days of inventory, right? The hospitals aren't sitting on the larger inventory. If anything, what we see in the hospitals is they really want consistent inventory. When we looked at that graph where the providers have basically a run up of inventory and drawdowns of inventory, they definitely have drawdowns in the hospital, but they really want consistent. They want exactly the right numbers because their demand side is, I don't want to say relatively flat, but it doesn't have the same variability as the other side. So there is an opportunity, right? We were talking about supply chain, right, in bags, but there is a very real opportunity to work with some of the bigger hospitals to understand, well, what do they have in their hospitals and automate that part of it as well.
Sure.
Because those definitions now are set, which is really cool, right? So we can talk to the hospitals, we can talk to the other providers to use those definitions to then basically also gain insights on what's happening, from their inventories as well.
Absolutely. Thank you for answering that.
Yeah, and one of them discards, right? I think we're all very interested, especially with platelet discards. Are we really shorting, just because of the turnover? Is the discard rate at the hospitals, what does that look like, right? And that's in some ways hard for us to get real detailed data on and understand that, and specifically tracking it over time, right? So also tracking.
Yeah, it's also interesting, and we haven't jumped deep into this, but when we talk about bacterial risk mitigation and the changes that occurred in the types of platelet products available, what's that do to time on product? But it's also what's been the impact on discards. So again, we're back to when you have discrete, rich, daily unit level data, you really can dig into questions. And we've contemplated the hospital side of this. We've contemplated a bit of the critical supplies side of the equation, but however you want to frame it, when we finish swallowing this elephant, we'll look to the next.
Yeah. No, you've done a wonderful job. Thank you.
Hey, Claudia, this is Stacy. I just want to follow up because Cassandra asked a question, and I think I want to understand from Martin and John. Martin, hello, haven't seen you in a while.
Stacey.
So what I took John's answer to be is that you're assuming when a product moves to the hospital, it is off of the inventory and is never returning back. So are you not accounting for the consignment model, and you're assuming it's a sale and it's out of inventory when it goes to the hospital? Because I think that gets to Cassandra's point and something we have to understand how you're thinking about it.
Yes.
Yeah, one of the objects, well, first, if something gets returned, that's part of it, right? So there are returns. But to your point, there's once product goes out, and if any of the providers are notified of a transfer, we also capture that. So that is one of the data feeds that comes through. But you're absolutely right. When product for large organizations, and ultimately resiliency of supply is a local issue, right? Does that blood center at that hospital have a right enough product? And so we don't get into that because basically we don't have those pieces of data. That's one of the opportunities that we would look at in the future.
So you're basically, just to confirm so I understand, product goes to the hospital, you assume product is used. So if it's a model where the product routinely comes back, or it's a model where in the rural hospitals, they're not using, but they have inventory there that could be moved in the event of a mass casualty, that's not really being taken into account in the way this is currently designed.
Correct, right? So
Well, qualification, we do track returns. So if returns come back to us, we can count those. Similarly, there's accounting for and capture of import-export activity.
Yeah, I wasn't thinking about the import-export. I was thinking about the difference between the consignment model and the model where there's a no return policy. And that is something I think this committee will always have to evaluate, because that does change the way we think about available blood supply.
I'm going to close the discussion now so that everyone can go to lunch. We need to reconvene at 10 minutes after the hour. Thank
so
you.
much.
thank you,
I
everyone.
have a lot of questions for you myself. I'll take them offline. Thank you.
Thank you.
All right, thank you.
Produced by the U.S. Department of Health and Human Services.